Hello, Wendy Amy, a therapist in Hampshire, UK. I found with a recent OCD patient that using outcome measures, I could see at a glance that that patient would get immediately better after a session and maintain the improvement if I saw them a few days later. But if I left it a week or two, then that patient would be back down where they started. Unfortunately, try as I may, I did not succeed in helping this patient break the habit. We had 7 sessions in all, but the end score was the same as the outset score. I hope it's not just me that has this difficulty. However, having the outcome measures was so helpful because this patient used to present in very much the same way, whatever the mood, whatever mood he was in. One of those kind of unfathomable characters, if you like. But the outcome measures were invaluable with this patient because the patient would happily tick the boxes or put marks on the line, but not actually tell me what was going on. Because of the above, I came to consider that actually attention was a significant contributor to the mood, and rather like some traumatized people, this patient sought out, in my view, sought out situations that caused discomfort, like seeing me and sharing the problem in some way, and yet paradoxically this seemed to help that patient. But they were unable to build on the positive changes. And in my view, actually the patient's partner was a contributor to them being able to maintain the status quo and not move on, because that partner was giving the patient constant attention, different to mine, but I believe it supported the problem, even though that patient was able to live a relatively normal life at time. One of my colleagues, Rita Lehman, considers that many patients in therapy are trying to get the unmet needs of the child met in the adult life today. And when I explained this to this particular patient, they agreed with me. Sadly, that knowledge seems not to have helped them to move on. Still, the outcome measures illustrated clearly what was going on and supported my explanation that continuing to see me was not helpful to that person's recovery. So I referred them on, and I think that was absolutely the action that needed to be taken. Thank you.